Hello, I'm Professor Khalid Khan from University of Granada in Spain. Today we will talk about how to prepare a research grant application. And to discuss the topic, I have with me Dr. Janneke van Hooft. Janneke, please could you give a brief introduction of yourself?
Thank you, Khalid. My name is Janneke van 't Hooft. I'm a consultant gynecologist and epidemiologist working at Amsterdam Medical Center in the Netherlands.
Okay, Janneke, thanks for joining. And today's topic actually proposed by yourself, triggered in part by your own experience of writing a grant application recently. Do you mind just explaining what the background is?
So I, together with other researchers, we thought a very great idea on doing a research grant. And then writing this grant, there was on this application the question, you should be groundbreaking. And then I was having a problem with what is actually the definition of groundbreaking and how can you convince this grant application that your research idea is really going to be groundbreaking. So then I ask you, Khalid, please help me to really clarify what it is and
Sure.
how we should tackle that.
Yeah, so uh, here, as part of my own track record, I show in a bar chart where each bar represents each grant that I have won during the last 15 years. You can see that the amount of money varies a lot between several tens of thousands to several million. And the amount of money doesn't necessarily reflect the groundbreaking nature of a grant application. And hopefully we'll be able to explain this as we go forward. The process of getting funded is that you submit an application, it is peer reviewed, you give a response to the peer review, the panel makes an assessment, and the funding panel, if they decide to fund you, your university then has to sign a contract with the funder, and then your project can begin. So that's in a nutshell. The key uh, problems are that new researchers, when they submit an application, don't necessarily know what is going to happen after the submission is made. Um, Janneke, what did you think about the role of peer review when you were submitting your grant application?
Well, as a researcher, you know the process of peer review of your manuscript. So my initial thought was, okay, it will be the same. I give my research plan to a bunch of three peer review um, people, and they will say, okay, this is going to be successful or not, and that is it. But apparently, I was wrong.
Okay, so let's look through. I explain the process in a as generic a way as possible, and based on my own experience as a peer reviewer as well as funding panel member, both in the UK but also in European settings. In, for example, uh, the German funding scheme for clinical trials. And I found that the process is similar to what I have experienced in the UK NIHR. The application, once received, is sent by the funder's office to several peer reviewers. It's not uncommon that a grant application is assessed by six, seven, or eight peer reviewers. Each one of them bring their own expertise to assess the application, and the assessment is normally on a prescribed pro forma, where Not only they have to give comments, but also to give a score. The applicant then gets a chance to see the comments and has an opportunity to provide a response. It is possible that the peer review is mistaken, and the applicant has a chance to correct them. And then the research office sets a panel and sends the score comments and response to the all the panel members. But normally one or two are nominated as the lead members for a given application. So here in this diagram, for example, for this one application, there is a single lead, and for this other application in the same round, there is another lead. The lead speaks about the application to the entire panel and give their summary and also give their proposal for a score. Uh, and then once their deliberation has been um, presented, the other panel members have an opportunity to speak about the application uh, and suggest their own scores. And finally, the whole panel votes for each of the application, whether or not they are lead on it. At the end of the assessment period, which may be spread over a couple of days, uh, all the applications assessed are ranked, and those that are at the top obviously get funded. Even very good applications may not get funded depending on the amount of money available to fund and the competition. So, Janneke, you yourself had an experience in handling the peer review comment in your application. No?
Yes, this peer review panel gave us some feedback, and one of the feedbacks provided was actually something we did not agree on, and it was difficult because we thought, okay, if we don't agree on that feedback, we might not get the funding. But on the end, we discussed within the group that it should still be a research project we feel confident about and we feel that it's feasible. So we did our best to explain why we were not agreeing with this reviewer. And apparently, on the end, the knowing that the lead panel member is the one deciding, we were able to convince this lead panel member by our arguments. Yeah.
Very good, very good, very good. This is very important because look, the investigators often think like Janika said earlier, that peer review has the deciding role. But in the case of funding, unlike in peer review for publication of articles, the panel members have a deciding role. They are human beings, so they not only have scientific but also personal opinion in their assessment. And normally, a funder should give their panel members names on their website as part of the transparency agenda. So investigators can go to the funder's website and check out who the panel members are. They can even make a guess at who might be the lead applicants, lead panel members who will assess their application. This, this information is helpful in preparing the application. The assessment criteria, I will list them here. Often, one element relates to priority. And here we look at disease prevalence, effect on sufferers' life quality, health cost to the health system, and patient priority. Sometimes the funders have already set priorities and they are declared in their announcement of the funding scheme. Janika, you thought that this is what need to be the important element with respect to groundbreaking, no?
Yes, I thought the research topic I had is a very relevant and prevalent condition. So that should be the groundbreaking issue on this application.
Okay, so hopefully I will be able to explain that the word groundbreaking is confusing. um, and how to think about this in preparing the application. Another element in the assessment is, why is this study needed now? And usually this requires demonstrating through systematic review that a gap exists and that your project will fill this gap. Or sometimes you have to demonstrate that there is a need for replication, because replication is now uh, given as much importance as novelty as science is moving forward. So, once you pass these two stages, the next two elements that are key to the panel's assessment are whether the project is groundbreaking and whether it is feasible. What is the operational risk? And in addition, they also consider, once the project is successfully completed, whether it will have an impact on the scientific level and at the societal level. Now, we tend to think about the societal benefit as the groundbreaking element, but it isn't always the case, because what we need to think about is the intellectual element with respect to scientific uncertainty. So, once we establish what is the state of the art in the scientific area, we can then identify what is the gap in the science. And then, by filling that gap, we can say we are addressing an intellectual challenge that is um, of a high gain nature. The contrast to this is the low intellectual challenge, where the scientific aspect does not have much to gain from the project. In this case, possibly an argument can be made that you want to replicate a previously tested scientific idea. But you will need to tailor what you write in this aspect according to the requirements of the scheme to which you are applying. Another element that is relevant is the feasibility. So you may think of this as operational risk. An experienced researcher with a track record in the field, with previous pilot work, working in an institution that has undertaken the same kind of projects previously, you could say will be a project that has a low operational risk. On the other hand, a young researcher with less experience and track record will have a high operational risk. For this reason, frequently, young early career researchers have schemes dedicated to their level of experience, so that they're not competing in the same scheme with other experienced researchers. On this element, Janneke, what was your experience in the application?
Well, this application asks for a senior researcher as a main applicant, and that person should be convincing enough to be able to perform this groundbreaking research within his team. But the nice thing of this application, I am a younger researcher, is that it also asked for a team that was mixed. So there were some senior and younger research, so that um, actually it also offered the opportunity to give younger researchers also a groundbreaking avenue in research.
Okay, so this is important. The lead applicant and co-applicant's role should be described. Normally, the responsibility lies with the lead applicant with respect to operationalizing the project. So it's possible in this situation for younger researchers to join a senior researcher to demonstrate operational feasibility. So, going back to the graph, there could be a project which has a high intellectual challenge, but is practically unfeasible. In this case, you might say it is overambitious, and this type of project may not be funded unless the scheme is specifically targeting high risk projects. As far as operational risk is concerned, there is a possibility that there is a possibility in any project that it might fail. There is normally a responsibility for the applicant to explain that how they will manage the operational risk if the project is funded. For example, in a randomized trial, if you propose to do the study in 20 centers, your risk mitigation strategy might be that if recruitment fails in some centers, you have a backup list of centers that could join you in the course of the project. Now, on the other extreme of the over ambitious is more of the same. This is a type of project that's easy to do and normally is a repetition of what has been done before. Um, in this type of project, there may be no intellectual challenge, but there may be gains to be made for society. For example, a phase 3 clinical trial normally is carried out after several small trials have previously been conducted. In this case, there is frequently no scientific challenge. The main challenge is the recruitment of large number of people so that confidence interval around the effect estimation can be narrowed down to gain certainty about decision making in healthcare. And
And
there are
could you
specific schemes that would fund this type of research. And in this type of research, it wouldn't be necessary to demonstrate some intellectual challenge of a kind that you might say is scientifically groundbreaking. Janika, you were asking me something.
Yes, because I was triggered by the fact that you said, okay, this could change clinical practice in such a way that you can say it would be clinically groundbreaking. But that is very much different from an intellectual groundbreaking grant.
Absolutely. So, for example, when a new molecule is being tested for the first time in humans for their safety and possible effect in treatment of a condition, in this case, the expectation that it will change practice directly at the end of these first experiments isn't there. But this type of experiment, you might say, is scientifically groundbreaking in an attempt to discover a new treatment. But several years later, when you do a large randomized controlled trial of this same molecule, at that time, perhaps intellectually or scientifically, the project will not be groundbreaking. But the project is important and necessary to establish how this molecule, previously established through groundbreaking research as being a potential candidate for treatment, now can how it can be used in practice. So I hope that makes the differentiation between uh, finding an effective solution to solve a problem in healthcare versus discovering through science something new that is of scientific value. All right. So the other terms that we often see in the grant writing literature is breakthrough, disruptive, or incremental. Well, more of the same or bit more of the same, you might say, falls in the incremental category. And these type of projects are often difficult to fund unless the scheme specifically is looking uh, for this type of award. So some schemes are looking for these scientifically disruptive or breakthrough projects. And on this graphic, they fall in the ambitious category, where they may be not as high intellectually challenging, but they are also not unfeasible. And this is the kind of area where funders would be looking to fund. You need to be away from incremental change. You are looking for a step change. and you're looking for a project that is operationally feasible. So here, depending on the scheme, you would want to place yourself with respect to being groundbreaking, balancing it with the possibility of being operationally feasible. I think this is where your project fell, Janika, in the end, and then you were able to get funded, no?
Yes, we were able to, at least in this grant application, to convince the lead panel member that we had an intellectual challenge research question that was feasible. So we had a good risk mitigation plan, and we were able to convince the panel members that that was the case. One question, Khalid, is the word disruptive. What do you actually mean by having a disruptive application?
Disruptive is something that brings about almost like a complete change. For example, um, in the setting of histopathology, usually you complete medical school that do several years of specialization and then with human eye looking through the microscope reach a diagnosis. But if a computer camera with an artificial intelligence program can achieve the same and do this repeatedly uh, hundreds of times in 24 hours without becoming tired, this is disruptive. So this is disruptive in two ways, both scientifically and practically. Uh, Bringing in computer science into healthcare in this way, you could say, is, um, in the intellectual sense, a step change. And then in practice, assisting a small number of humans uh, who are then assisted by this technology to deliver high throughput of diagnosis. This is disruptive at practical level.
Cool.
So once the panel makes these assessments concerning the intellectual and operational levels, it then also considers whether the completed project will have scientific impact and societal impact. And then ultimately, depending on the nature of the scheme, um, some people who are lucky on the day will get funded. Because usually almost all the people who are applying will prepare very good applications. So the difference between the ones that get funded and those that don't is usually quite small.
So thank you, Khalid. This is very interesting, and also it had helped me to understand the grant application process. Can you just finalize with a take-home message for everyone who is applying for a groundbreaking grant?
I would say very strongly that you need to study the particulars of the scheme to which you are applying. For example, a scheme that is looking to fund large randomized control trials. Here, they are not necessarily looking for an intellectual breakthrough. They are simply looking to establish the evidence base for decision making in healthcare through large numbers of people being recruited. So, the challenge in preparing such an application is more concerning operational feasibility. Whereas, if you are thinking about discovery of new genes behind particular cancers, perhaps the scientific challenge here is far more important than how this information will ultimately be used to make clinical decisions. So tailor what you got to write according to what the scheme is set for.
Thank you. Thank you so much.
Thank you, Janika.